All right, thank you, Dylan. Well, the chief medical officer for Baptist Memorial Hospital Golden Triangle says they've seen an increase in the number of COVID-19 patients over the last month. Stephen Pimpo spoke with him today to find out what people can do to avoid the virus and stay healthy. He joins us live from Baptist with more.
Winston, that's right. The latest report from the Mississippi State Department of Health shows just over 1,400 new cases of COVID-19. Meanwhile, the World Health Organization announced today that over the last 6 weeks, hospitalizations for COVID-19 in Europe have tripled. Now, speaking with leadership here at Baptist Memorial earlier this morning, they told me the best thing that Mississippians can do is to be smart and continue taking full advantage of all available treatment options. It's something no one really wants to hear, but
COVID is here. It's here to stay. People have let their guard down, and I understand that, but you still need to be smart about what they do.
Dr. James Martin, Chief Medical Officer for Baptist Memorial Hospital Golden Triangle, says COVID-19 cases are once again on the rise.
We're seeing an increase kind of nationwide. Here in Mississippi, Lowndes County is currently at a medium level. So is Oktibbeha, Clay. Monroe, when I looked today, was at a high alert, according to the CDC.
The hospital says they'll have anywhere between 5 to 10 COVID inpatients at a time, with an average stay of 3 to 4 days.
We went through a probably several month spell where we had probably 0 to 2 inpatients, but the last 30 days, 45 days, we've seen that increase. Probably as high as 15 at times.
He says that one reason is the rise of the Omicron BA.5 subvariant, which the CDC says is more transmissible, better at getting past the immune system, and is causing almost 2 out of every 3 new COVID cases.
The biggest difference seems to be they don't seem to be quite as sick on the inpatient side this time. There's still a lot of patients coming in the ER with some symptoms.
Dr. Martin says the best way for Mississippians or anyone to guard against the new COVID strain is to take the same safety precautions laid out since the start of the pandemic.
To me, the biggest thing is if you're sick, stay home. If your child's sick, keep them home.
And take full advantage of all treatment options, especially the vaccine, booster shots, or pills like Paxlovid.
It's shown to work real well, and I've used it on several people. My dad included.
Especially since things could get worse before they get better.
I think we'll continue to see a slight increase in cases probably for the next several weeks. And then again, when school starts back, we may see another little uptick. But as long as we stay kind of where we are as far as the severity of illness, we'll be able to get past this surge without any trouble.
Now, Dr. Martin made sure to tell me that their current patient levels are nowhere near what it looked like earlier in the pandemic when staff was overwhelmed. He says that they're continuing to manage as they go on, although everyone is dealing with staffing shortages across all health systems. To see which COVID options you qualify for, you can go to WCBI.com. Reporting live in Columbus, Stephen Pimpo, WCBI News.